Hello everyone, welcome back to my channel. I hope you guys are doing really well. And today I'm going to talk about a condition which is really common, that is UTI. So without any further ado, let's get started. So what is UTI? So UTI is a urinary tract infection which affects our urinary tract. That includes your bladder, kidneys, and the third one is your urethra. And urethra is a tube that carries the urine out of your body. And now the question arises, how do I get to know if I'm having UTI? So the symptoms of UTI: pain in your tummy, or pain or burning sensation while urinating. These are the two most common symptoms of UTI. And there can be fever or urge to urinate more often than usual. What are the causes of the UTI? So there are many causes of the UTI, but to name a few, first is the bacteria that can enter your urinary tract through your poo by having sexual intercourse and during pregnancy. Second is the kidney stones. If you have kidney stones, then you are highly susceptible to get these infections. Third one is by not drinking enough fluids, for example, water. And the fourth one is by not keeping your private area clean and dry. And UTI is more common in females than males because females have the shorter urethra. And now comes the treatment of the UTI. So if you have fever or pain in your tummy, so you can take paracetamol 3 or 4 times a day. Okay, but the mainstay treatment of the UTI is antibiotics like trimethoprim 200 mg that you have to take 2 times a day for 3 to 5 days. And it's really important to complete the course of this antibiotic. Okay, so as you know that all the medications have some side effects, so this medication also has some side effect like rash or itching, but don't worry about that. It will subside by itself once you finish the course. Okay, and the second antibiotic is nitrofurantoin, but the most common antibiotic that we use for the UTI is trimethoprim. And it's really important to drink enough fluids and to keep your private area clean and dry. And if you are sexually active, try to avoid the sexual intercourse until you feel better. Also, it's always better to take a PPI, for example, ranitidine or pantoprazole on empty stomach whenever you're taking any kind of antibiotic to prevent some side effects. Now, how can we prevent ourselves from having the UTI? So there are some do's and don'ts that I would like to discuss with you guys for the prevention of the UTI. So let's discuss the do's first. Okay, first is wash your genital area from front to the back and not from the back to the front. Drink plenty of fluids, water, juices and all. And if you're sexually active, pee as soon as possible after sexual intercourse and wash your area after sexual intercourse. And now comes the don'ts. Do not use the scented soap down there, and do not hold your pee whenever you urge to micturate. And do not wear tight underwears or synthetic underwears like nylon. Instead, you can use the cotton underwear. And do not have a lots of sugary food because that can encourage the bacteria to grow. And there's one more thing that I forgot to mention, that you can have the cranberry products like juices or cranberry tablets. I personally don't recommend it because it contains a lot of sugars. Yeah, so I don't personally recommend it, but you can have if you like. And the antibiotics that I've mentioned like trimethoprim and nitrofurantoin, these are not taken during pregnancy. These are not safe in the pregnancy. These are not safe for the baby. So there's another antibiotic if a person is having UTI during pregnancy, and that is amoxicillin. And if you're having 3 episodes of UTI in a 1 year and 2 episodes of UTI in 6 months, you have to take some other medications, and for that you have to speak to your doctor. Then they will do a urine test for you, and according to that they will prescribe you some medications. So that's all for the UTI, and if you have any kind of questions, feel free to ask me. Okay, and till then, take care, and I'll see you with another video in a few days. Bye, take care.